Hey guys, so hopefully this is going to be my last response for a while to quote-unquote non-binary people who are considering some form of transitioning, or already going through it. I already did the whole open letter to them. I've already done like 1 billion videos addressed to them. I'm just kind of sick of making these responses at this point, not because I don't think they're important, not because I've really changed my mind on anything, but because I'm just burnt out at this point, really. I know that these sort of responses are very important, not necessarily to the people that they're addressed to, although I do hope that I can reach out to them at some point, and that's why I try to make these sort of responses as calm and collected as I can, especially because in these videos, even when there's just somebody like Ash Hardell in this case, they're not mocking the actual people who are suffering. It's not like saying, oh, you know, I don't like how long my hair is, therefore I'm dysphoric. No, they're not necessarily doing that, so I make my responses a little more calm and my videos a little more serious, especially because the topic is pretty heavy-handed when you think about it. So, yeah, and I want to bring this up, and I want to make this absolutely clear to Ash. Just to make this absolutely clear, I'm going to have a conversation with Ash sometime in the near future. I'm not sure exactly when. We think it's going to be sometime in July. Not exactly sure, but we're working on it. Some sort of conversation over Skype or something. Just because I'm making this video, and I'm probably still going to make responses to Ash, if she makes videos that I find worthy responding to, that doesn't mean that this conversation is off or anything. We're still going to have it, and it's not going to be a debate or anything. It's not going to be live streamed. It's going to be a personal conversation just between me and Ash, maybe a friend of mine, a friend of hers, or something like that. But probably just between me and Ash. We're not completely sure on the details just yet. But we're just gonna try to figure out our differences, figure out kind of where we're coming from on our respective sides. So I am looking forward to that, because it's sort of trying to build bridges there, although we've definitely had our disagreements in the past. I still think the messages that Ash is spreading, I still find that to be quite disrespectful and behavior that I really don't like. But enough of that. Our conversation is still on, Ash. Despite what I'm going to say in this video, and despite that I'm advising you against what you're talking about. It's about Ash's surgical consultation for top surgery. And I don't think top surgery is the right decision for Ash. She's talked about her chest dysphoria in a previous video, which I responded to, and the reasons she brought up for dysphoria were all social. And so I'll talk about this more later. So let's get into the video.
Hey everybody, how's it going? So this is a video that I'm making for a few reasons. One, I want to hold myself accountable. I've made a decision within myself, and I think it really feels like the right decision. And I think if I were to backpedal from this decision, I think that would be out of fear and not because I would genuinely change my mind. Especially because this decision has no consequences. It's not like I'll make this decision and my life is forever changed. This decision is simply to acquire information so I can make a more informed decision about a real thing that could have consequences later down the line.
Okay, so Ash is partially right and partially wrong here. Yes, a surgical consultation does not have any real impact on your life in terms of what it physically does to you. It is designed to just give you information about top surgery. You are absolutely right about that. And top surgery is what has real consequences. So you are right about that. However, the other intent of a surgical consultation is that you're going to have surgery. When you have a consultation with a surgical team, with your doctors, the intent, what you're communicating with your doctors is that you're going to have surgery. Now, it's not binding, you can go back, but it's understood that you're going to have surgery. You've gone through enough steps now that you've basically told them that you're intent on having surgery. So yeah, you've basically told them, I want to have surgery, and I'm going right to the next step before you have surgery. The fact that you think that that's not what it is tells me that you're either misinformed or you're misleading them, and considering that you actually seem to be quite the nice person, I think that you're just misinformed a bit. So to clarify that, Ash, and I know this because I'm currently going through the process for top surgery, I'm not actually going to be getting it until next year, but I am currently going through the referral process for top surgery. I know that a consultation means that you're going to have top surgery, and there are about 1 billion steps you have to go through before you even get to the consultation.
So, a while ago I made a video about top surgery and about how I desire it, and if you didn't know that, it's no problem. or how I think I desire it. I'm unsure.
See, that's the thing. You shouldn't be going to a consultation if you're unsure about it. The whole point of a consultation is that you want surgery. That is the whole point. The whole point of a consultation is to inform you about surgery before you have it. The fact that you're going into a consultation unsure about surgery is really concerning. You should have made that decision before you had a consultation. That's why there are steps to get to the consultation. Either you went through those steps and you rushed through those steps, or you skipped over those steps. And I'm not saying that's necessarily your fault. I would say that's probably the doctors were negligent or something like that, which I wouldn't be surprised in this day and age, especially when it comes to trans healthcare, which I might talk about in some other video. But there are a lot of negligent doctors when it comes to trans healthcare, especially when it comes to informed consent clinics and all of that.
I used to think that all trans guys, always knew they wanted top surgery, and they never questioned it, and they did it as fast as they could, and as soon as the surgery was done, they felt amazing. It was, euphoric and fantastic. But so much of that is inaccurate. A lot of trans guys, trans masculine people, non-binary people, people who get top surgery, a lot of them question it, a lot of them aren't sure, a lot of them put it off because they don't know if they're ready. And then afterwards, even sometimes, once the surgery is complete, it is possible to kind of have a post-surgery depression, just because your body went through a lot. And then maybe a week down the line, or a couple weeks down the line, or a month, I don't know. After after the passage of some time, they'll be like, yes, that was totally the right decision. The post-surgery depression was simply because it was a big shock to my body. A lot was going on, sensory overload, etc., etc.
A few things to address there. What Ash is saying is partially true when she talks about top surgery for trans guys. It is true that some trans guys are nervous about the procedure at first and not 100% sure if they want it. However, pretty early down the line, they decide that they want it. And then they start the referral process. Not in the middle of the referral process, they decide whether they want it. No, you only start the referral process once you're sure. I've been through so many doctors. They checked me for dysphoria so many times. I went through a rigorous process with my doctors. And by the way, and I understand that a lot of insurance providers and other practitioners are really bad about trans healthcare. And mine, not bragging here, happens to be one of the best in the nation. So they are really good about it and really rigorous procedure about it and all that, to make sure that you're really sure about these procedures. Like I said, I'm currently in the referral process. I haven't even gotten close to my consultation. The fact that she got to it pretty quickly, I'm not sure how quickly, but it seems like she got to it pretty quickly. Anyway, the fact that she's acting like they just realized that they want in the middle of it or something like that, no. It's true that some are apprehensive at first, of course, because it's a big decision, but it's at the beginning, then you go through with the referral process. Not in the middle of it, or near the end or something like that, no. And the fact that she was lumping in the trans-masculine people and the non-binary people all in one group. No, top surgery is for trans guys. The whole trans-masculine, non-binary thing. That is not a valid medical condition. That is just an identity that hasn't been proven as anything yet. And even if it was legitimate, that would not be the same thing as transitioning from female to male. So stop lumping that in together, and more importantly, stop telling people who identify that way that they can just get surgery and that they'll be happy. Because the truth is, if you're not trans, then something that's for trans guys that's intended to relieve their dysphoria probably won't make you happy. I'm sorry, I'm getting angry about this. But that isn't something you should be telling people. You are generally spreading misconceptions, but I shouldn't be getting mad in this. I promise I wouldn't get mad in this. I'm just gonna calm down.
So what was I talking about? Oh, okay. So I'm making this video, one, because I want to hold myself accountable and follow through with this commitment I've made.
Okay, I do find this legitimately dangerous. Ash said that she wants to hold herself accountable and follow through this commitment, but she said she's not 100% sure. So that means that she has an audience of what? I know this is on her smaller channel, it's on her One Take Ash channel. Even this channel has 60,000 subscribers, but her main channel has over 200,000 subscribers. So that's potentially 200,000 subscribers. And I know subscribers don't mean everything. Let's say that half of her base isn't actually really watching her and is just accounts that don't really watch her. So let's say it's 100,000 subscribers, potentially 100,000 subscribers who are really dedicated to her and want her to follow through with this. So even if she decides that this is not good for her, and she doesn't want to do this, that's potentially 100,000 people pressuring her into this, because she's made this promise to them. That's not good, Ash. That's not good.
And two, because I think it's important to, like, because I had this misconception that anybody who wants top surgery just knows they do. So but I've learned that that's not the case, and I kind of want to, like, further that knowledge. I want to make that more clear to people. And then, in turn, kind of offering myself up as visibility and representation for that. So if you feel this way, you're not alone. Here's a human who also feels the way. But the thing I decided, it was a big decision, kind of, not really. The thing I decided was I am absolutely 100% totally, completely going to, and even if I think that I don't want to, I'm still going to go through with it. I am going to get a top surgery consultation. I'm going to sit down with a doctor and talk about it. Just talk about it. And that's why I feel comfortable saying I'm not going to back out of it, because, like, what negative consequence can come from talking about it? Nothing. Like, you don't talk about it, and then I feel like this QuickTime thing, his weird motion going on. Anyway, they're nothing is set in stone, nothing is irreversible from having a consultation. It can only, like, I feel like only good can come from it, besides maybe it'll cause me a little anxiety and be slightly stressful.
Hey Ash, like I said, you are partially right and partially wrong on this. Yes, people are apprehensive at the beginning. A lot of them are, because it's a big decision. But if you really want top surgery, you're going to make that decision pretty quickly. And then you're going to go through the referral process. Not like in the middle of it. The referral process is a long process if done properly. And the fact that you refer into it like you just magically went to your consultation, which means that you want surgery. When you go to a surgery consultation, you are indicating to the doctors that you want surgery. The fact that you're indicating that you were just going to your consultation, I don't know if you've been through the referral process or not. It really concerns me, though it sounds like you haven't. Now, I could totally be wrong about this. I could 110% be wrong about this. But it sounds like you haven't been through the referral process. And another thing that makes me think that you haven't been through the referral process is because to get even start the referral process, I had to be on testosterone for at least 6 months. You haven't started testosterone at all, which I'm glad you haven't, because that would probably give you actual dysphoria. But this really concerns me, Ash, that your doctors are probably negligent. And I don't want you to go to negligent doctors, because so many of these people are going to negligent doctors. Milo Stewart went to doctors who literally did not know where to stick the needle. There are so many people, not even fully licensed doctors, can know where to stick a needle. Basic nurse training can teach you where to stick a needle in somebody's vein. I'm sorry, I'm ranting. I don't want you to go through those sorts of people, Ash, especially when all of your quote-unquote dysphoria is based on social factors. You shouldn't change your physical body through medical treatment because you feel social pressure and social anxiety. And on a side note, okay, I've heard of so many of these people saying, oh, I want top surgery, or I want to go on testosterone when they don't have legitimate gender dysphoria. And there's this new trend I've heard among these transgenders where they want to go on testosterone and then stop it, or they want to go on a low dose of testosterone. And I know Chandler Wilson talked about this in one of her videos. But that's literally abusing your prescription. Even if you get prescribed the proper dose of testosterone, that is not how you're supposed to treat it. So the fact that these people, like, they're misusing their medication, because that's what testosterone is when you're prescribed to go on it, that is your medication, it boggles my mind. It really does. So just the fact that these people, and I blame the doctors too, the doctors that are not properly diagnosing and evaluating and making sure that these people are getting the proper dosages and the proper psychological evaluations and stuff, and that these people could get real dysphoria that could potentially mess them up for life and even drive them to suicide. It's so sad and so tragic. But that was just my little ramble. Back to Ash. I'm sorry. Like I said, Ash, you're technically right on this. A consultation is not binding. You can technically back out of surgery after you have a consultation. But the implication of a consultation is that you're going to have surgery. It is the step before you have surgery, basically. Now, I'm sure there are other steps in between, and I don't know for sure because I haven't gone through this personally, like pre-op preparation, stuff like that. But it is the major step before you have surgery. It is. So the fact that you're just basically going into this blind, is concerning to me. And I could be wrong about this. Maybe she's not going to this totally blind. But you're going to this with relatively little knowledge on what the surgery actually entails. I know you did some research on what the surgical procedures are, but you don't seem to know that much about it. And not to insult you, I'm not trying to. I'm legitimately worried about this. You don't seem to know that much about it. And that concerns me. And like I said, you are technically right. There's not harm that comes from this. You can back out of this if you do want to. But it's likely that the doctors are going to want you to continue with the surgery. And they're going to do this for two reasons. One is probably for monetary reasons. Unless your insurance is paying for this completely, they will benefit from giving you that surgery. And two, because it's routine procedure. When you have a consultation, that implies that you're getting surgery. And speaking of money, consultations are not cheap. From my understanding, they're at least $100. Now, again, if your insurance company is paying for this, you shouldn't worry about this, so you might want to consider that. Surgery is not cheap, and considering that you want to get surgery because of the way people socially perceive you, it's something that you should treat as any other cosmetic surgery. And I have no problem with people getting cosmetic surgery. That's not the same thing as a trans guy getting top surgery, and you're treating it like it is. You're making a false equivalence here. And that's a huge problem I have with your video. This isn't the same thing as somebody who is getting a medically necessary surgery.
So that's a decision I've absolutely 100% made. So you can look forward to a video about that probably later. But it makes me super nervous. I think the thing that makes me the most nervous is I feel like I'll have to justify why I want the surgery and who I am.
Hey, this is another red flag. See, this whole video I feel like is just red flags. And that's why I'm making it. Because this really concerns me. And I am concerned for Ash. I legitimately am. As much as I hate what she says in the videos on her main channel. Because I don't want her to mess herself up. And a lot of people have brought up that there are plenty of women who are not trans and who are perfectly fine with being women who have gotten mastectomies or who have gotten breast reductions. And I understand that. But there's a difference between a woman who gets mastectomy, say, for cancer, or who gets a breast reduction because it's hurting her back, and someone who gets the kind of mastectomy that Ash is seeking. A mastectomy for cancer is a different type of operation. It's actually a lot more involved than the one Ash would be getting, so hers is relatively low risk, and I think a breast reduction, from what I understand, is less of a risk, because it's not removing all of the breast tissue than the one Ash would be getting. But both of those surgeries leave with a relatively feminine contour. I'm not so sure about the one for breast cancer, because obviously they kind of have to do what they have to do to remove the cancer. From what I understand, because I know somebody who had a mastectomy for breast cancer, a lot of women who have that kind of mastectomy get reconstructive surgeries so that they can have as feminine appearing breasts as possible. Anyway, those women end up with breasts with feminine contours, right? So they are able to live at least as happily as they can in the case of women who have had mastectomies for breast cancer because they have a feminine contour, so their breasts still look like female breasts. But when you have top surgery, especially the one that Ash is having, which gives you a very masculine contour, which gives you male-sized nipples, and gives you scars, which almost never fade, which will always be there. You end up with a male chest, essentially. A male chest with big scars. And that's not going to look right if you're a female and you have a female brain. That's going to give you genuine dysphoria. And that's what worries me. So, if Ash was getting a breast reduction, or a mastectomy for breast cancer, I wouldn't be too worried. It's not even so much that she's getting her breast removed, but having a male chest will legitimately make her dysphoric, and that really worries me. So yeah, I just wanted to address that point there.
But there is a really cool doctor this is the person that I think I'm going to have my consultation with, but this part could change. There's a really cool doctor, Dr. Corey, in Salt Lake City, who has done several surgeries on top surgeries on non-binary people, or people, AFAB people who have, at the time of the surgery, either were not on or have chosen not to ever go on T. So they have like a similar body to me, in a way, in some ways. And I really like the results of this doctor's work. I think these people look really good afterwards. It makes me comfy that she's like worked with non-binary people in the past. So yeah.
More to address here. First of all, as I've said in about a billion videos, you can't transition to non-binary. That's simply not a thing. Not only is it biologically not a thing, but it is medically not a thing. There is no medically established way to transition to non-binary. If you ask doctors how to transition to non-binary, they will say that it is not a thing, including my endocrinologist. And like I said, my insurance provider, though it does have its faults, is one of the best when it comes to trans health care. And they have been, for the most part, very careful not to be negligent when it comes to that sort of thing. And they checked me to make sure that not only did I have a diagnosis of dysphoria, but that I was female to male, and that I didn't identify as non-binary or anything, because my endocrinologist said very clearly that she would not give testosterone or refer to surgery anyone who identified as non-binary, because she said from her personal experience, the people that she worked with ended up regretting those sorts of hormones and surgery. And the fact that there's a doctor going around giving surgery to people who identify as non-binary really, again, concerns me, because that medically has been shown that that doesn't help, that that actually only makes it worse. And also, the whole, oh, well, I've been giving surgery to people who haven't gotten testosterone. Well, this same endocrinologist has also told me that even for trans guys who for top surgery genuinely helps with their problems, genuinely relieves dysphoria. Now, I know Ryan Casada has had top surgery and has not been on hormones, and he says he's fine. So I don't know if this happens to everyone, but this is a potential side effect, so this can potentially happen. My endocrinologist, because of this potential side effect, will not refer anybody who, like I said, has not been at least 6 months on T for top surgery, because of the potential effects. Not only can you get your best results if you have been 6 months on testosterone, preferably a year on testosterone or more, but if you've not been on testosterone at all and you're still in an estrogen-dominated system, some of the breast tissue can actually grow back. Not all of it, but some of it, once you've had top surgery. So yeah, there's that effect to consider. So that's not a medically established process, at least when it comes to female-to-male top surgery. Obviously, it's different from mastectomies on women. So the fact that this doctor ignores both those procedures with the testosterone thing and with the non-binary thing, shows that this is a negligent doctor who does not follow medically established procedures. And that you're going to this doctor, Ash, really concerns me. Again, this just really shows you're uncertain, in that the fact you're going as far as having a consultation, I mean, go ahead, have a consultation if you want. Like you've said, it technically doesn't hurt you, but the fact you're going this far when you're not even sure does worry me a bit. You shouldn't be going this far. You should be sure by the time you're going as far as having a consultation.
And I've decided for sure I'm going to have a consultation. That is absolutely happening. I am committing to that. I think that's important. I'm going to do it. I'm still not, sure whether or not I want to have surgery. I think I do. But even saying that kind of scares me.
So at this point, Ash starts getting really repetitive. There's one funny clip where she starts linking to a bunch of channels of other people who identify as non-binary and apparently want top surgery as well, which again is concerning, but I'm probably not going to review any of their channels. Apparently, Jude Carter also wants top surgery, and again, that's concerning again, because Jude Carter just went on testosterone. I already did a video on her. But anyway, she says, oh, I haven't reviewed all these channels yet, so if they say anything problematic, just know that I don't condone any of the problematic things they say. So that's kind of funny, but again, I'm trying not to make fun of her as much as I can. But honestly, I'm tired of making these sorts of videos. I think I've said everything I wanted to say. Only one person sent me this video, actually, it wasn't a lot of you guys. But I'd appreciate it if you guys wouldn't send me as many of these videos. Just because I want to stop reviewing them for a while and sort of do other content. I'm just sort of burnt out from these kind of videos, because they're honestly kind of depressing. It's depressing to see a lot of people mess themselves up, because I do honestly feel for them. I know they're going to make decisions they're probably going to regret, considering that a lot of their quote-unquote dysphoria is a lot of these people, it's either social roles, or social anxiety, or clothing, or something superficial like that. Yeah, so I hope you enjoyed this video, and thanks for watching.